Hello, everyone. This is Dr. Amigues, your friendly rheumatologist at Unabridged MD, and this is another Rheumatology 101 live, and it's such a pleasure. And today we're going to talk about back pain, and you're gonna hear why you may need a rheumatologist. Okay, so the other day I had the coolest patient, and um, why I say the coolest is because I really do love making diagnosis, and it is really cool. So she had actually they had actually already seen a rheumatologist, and that rheumatologist had said, "No, you're fine," because they had developed recently some joint pain of their hands. I'm changing a little bit things, and basically. When you actually were discussing the pain was, somewhat inflammatory. But what became very, very interesting is that listening to the story, what we realized is that they had stopped to use anti-inflammatory because ibuprofen, Advil, Aleve, all of those, because that had caused some GI issues. And the pain in their hands had started after the anti-inflammatory had been stopped. And the reason why they were taking the anti-inflammatory in the first place was that since a very young age, they had back pain. And so while the pain of the hands were not particularly inflammatory, although I think that at a young age, there's no, and I consider everyone under 50 to 60 young. The older I get, the I push it a little bit. So anyway, uh, so in this case, what's interesting is that, yes, the hands were not inflammatory, but when actually we started talking about the back pain had started at a young age, so before 20, and it was worse in the morning, associated with morning stiffness, and better with exercise. And that was the reason they were taking the NSAID, and then they had developed complication from the NSAID, non-steroidal anti-inflammatory drugs, so such as ibuprofen, Aleve, things like that. And so they had stopped the Aleve or ibuprofen because they had like they had caused some issues of their stomach, and so you have to stop it at that case. And basically, then we uncovered other joint issues. Okay, so number one, definitely an inflammatory back pain. Definitely the pain of the hands is likely to be due to the inflammatory back pain. And so I wanted to share this because I'm seeing so many people who think that it is normal to have back pain. And yes, you may have started to have back pain young, but that doesn't mean it's normal. You should not have back pain. There's no reason to have back pain. So when do you want to see a rheumatologist? And here are the things that I'm going to tell you that you have to tell your rheumatologist when you see them so that they, really listen to you. If the pain is worse in the morning, if you wake up with morning stiffness where you're like, oh, I need to move, I need to do crack, 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 that is what we call morning stiffness, especially if it lasts more than 30 minutes. Like if you feel like, oh, I'm always so stiff in the morning, it takes me 30 minutes to finally be okay, that's when we are talking about inflammatory, like morning stiffness and inflammatory arthritis. And then if you feel like you have to do exercise, that's another reason to be inflammatory. That's another inflammatory component. So worse in the morning, associated with morning stiffness, improve with exercise. Those are like 3 components of inflammatory. And of course, it responds to NSAID, and it doesn't respond as well to Tylenol or paracetamol. Okay, because that's a different mechanism of action. Or even narcotics. Honestly, I've seen patients who were put on narcotics for their back pain, but ultimately it was all inflammatory. You start them on a medication to take care of the inflammatory arthritis, and boom, they are totally fine. No need for narcotics. I mean, how cool is that, right? So now what I want to share here is a couple of things. Number one, when you have an inflammatory back pain, you may not realize that you have an inflammatory back pain because, like this previous patient, you're taking anti-inflammatory and you don't even realize that that's something you're taking on a daily basis, okay? Number two, maybe you have realized that exercising is something that helps you, so that is all you're doing. So I have actually at least 3 people that I know of that are rock climber like I am. Actually, they're way better than I am. And they actually have typical inflammatory back pain. Two of them know that they have something called ankylosing spondylitis with HLA-B27 that's positive, right? And the only thing that they need to take care of it is doing rock climbing. And they are incredibly good at rock climbing. And so, it's actually interesting is that they started rock climbing. They started seeing that they were feeling better with it. And so that's what they decided to do. So that's all they do. They rock climb and they know that they are going to develop back pain if they stop. So I think that that's actually really interesting is pause. It doesn't mean you're going to be on a medication, but wouldn't it be cool for you to know what's going on? So if you feel like your back pain gets better with exercise, it is inflammatory, most likely. If you feel like your back pain is better as the day progresses, it is most likely inflammatory. And then if you have morning stiffness in the morning, it is inflammatory. Now, when we have an inflammatory back pain, you can have different reasons for that inflammatory back pain. So I like to say that it's the family of the spondyloarthritis. So spondylo means spine. Arthritis is, arthros, that's joint, itis, inflammation. So it's spine, joint, inflammation. And under the spondyloarthritis, there's many reasons to have that. So one of them is ankylosing spondylitis. Usually it can be HLA-B27 and it affects the low back very often. It can affect also the chest. So if you're having pain in the sternum, that may be something that we want to look at. Okay, so that's the first one. The second, psoriatic arthritis. You may have psoriasis. You may have nails changes. So if you feel like my nails are looking so ugly, I'm sorry, and you're putting painting on it, or you have peeling of the nail, or it breaks up easily, that could actually be psoriatic arthritis because psoriasis of the nail is linked to psoriatic arthritis. Okay, so that's a big one. And then you have non-radiographic spondyloarthritis, where on the X-ray, you don't see that there is arthritis, but we know that if we were to do a biopsy or MRI or even biopsies of the sacroiliac, we would actually see inflammation, okay? So that's important because you treat patients that have non-radiographic spondyloarthritis. You can also have inflammatory bowel disease that can cause inflammatory arthritis or spondyloarthritis, okay? And then there is reactive arthritis when you have had an infection and you develop a reactive arthritis. So that those are also things that can happen, right? So this is important, is to realize that the inflammatory back pain that we are talking about can actually be the window for us to figure out another type of arthritis, okay? So in the patient that I was mentioning, when I started looking, we actually learned that in her family, she had psoriasis. So my suspicion is pretty high that they have psoriatic arthritis, because you can have psoriatic arthritis without psoriasis. But really, what's really cool about that story is to realize that they thought that having back pain was normal. So they actually, on their own, did not mention their back pain to the rheumatologist that they saw. And it's only because I was like, hold on, do you have back pain? Because that's an important question. And we're like, they were kind of like not wanting to talk about that. And I was like, hold on, I need to know. I actually really need to know. And then you unroll the story, which is having back pain for a very long time, very inflammatory effect, but doing well with NSAID. Then the problem is not able to continue the ibuprofen because of the GI tract. And then having not only the back pain, but also developing some peripheral joints, so peripheral, anything else than the back, right? So, and then you're like, wow, like we figured it out by just listening to the patient and realizing that back pain is not normal. All right. Hopefully, this was helpful to you. If you think that if you're here, that means that you're liking and you're finding this information useful. So I'm going to ask you to share this with someone you think will find it useful as well. I'm going to ask you also, if you want, and if you're willing to subscribe to the YouTube video, because that is a big way that we can share this information to more people. And I'm really a big fan of making sure that patients and people are empowered, because if you listen to this, you may actually do something about it, right? And then you get more information about what's going on. And I'm just going to say hi and bye. Hi, Keith. Yeah. Uh, family traits. Yeah. So your Keith is saying, Doctor, I noticed you mentioned family traits. I have been immune disease on both sides. So my sister and I are doomed from birth. We're doomed from birth. Yeah, I don't know that we can say doomed. You know me at this point, right? I think that some people have more autoimmune disorders, but that might actually be a good thing because maybe you have less complication from other things, right? So your immune system is overreacting, and maybe you're smarter than the vast majority of people who we don't know, right, those links. So I think that that's number one. So I always, because I have the BRCA gene from my mom, and so my brother was like, well, great, genetic. And I'm like, yeah, well, we also got the don't take no for an answer, but the grit of my mom, right? So like I cannot say, oh, boo for the BRCA gene and yay for other. So we cannot choose. That's the bottom line. We don't choose what our parents are giving us. But we have incredibly powerful medicine that we can help with autoimmune disorders. So I'm going to just say it. It's fine. You're not doomed, because it's better than some dementia, for example, that can be genetic. So I would take an autoimmune disorder anytime, since we can actually treat it. So that's number one. But thank you for sharing that. And if you're watching this as a replay, please #replay. I'm so sorry I came a little bit late. So of course I probably have lost some of the live listeners and viewers, but I try to be here, and it's always a pure pleasure, and it's always an honor to be here. And I know you were joking. And I will see you next week. And again, if you can subscribe on YouTube, that would be awesome. And I would really appreciate it. And if you are looking for rheumatologists, we're still taking new patients. And it's really an honor to take care of this community. Have a wonderful week. I'll see you next week. Bye-bye, everyone.